Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Treatment of hyperlipidemia, HMG-CoA inhibitors, cholesterol absorption inhibitors, bile acid sequestrants, and PCSK9 inhibitors. Then the next drug is MTP inhibitor. MTP inhibitor is lomitapide. This lomitapide it actually decreases the VLDL production. So it is used in conditions like familial hypercholesterolemia. We can use this MTP inhibitors. The side effects of MTP inhibitors are these can cause nausea, diarrhea. These can cause increased hepatic fat also in the patients.
thank you and thank you for watching.